This is Dr. Priyadarshini, one of the mentors with StudyMEDIC, and today we are going to discuss on the topic Pediatric Gynecology. Pediatric Gynecology is one of the important modules, and here the topics that you're not supposed to miss include puberty and pubertal changes, amenorrhea, more importance given to primary amenorrhea, disorders of sexual development. This topic of amenorrhea and disorders of sexual development can come as scenarios where we need to understand what is the diagnosis and how we arrive at the right diagnosis and management. Cases of child sexual abuse, you need to know a bit of that, and vaginal discharges that can present in the pediatric and the adolescent age group. Also, not to forget, there are some adnexal masses and the child can present to an emergency because of these masses too. Coming to in-depth discussion on the topic vulvovaginitis. In children, because of the hypoestrogenic state that is present, the vagina is highly susceptible to infection. Also, we need to remember the mucosa is quite thin in this age group, and also the pH is alkaline, whereas in adults it is acidic in nature. Now, also because of some behavioral changes and because of the poor personal hygiene, they can be at risk of developing contamination, and dirt, sand, all these can be a cause of vulvovaginitis in them. So with vulvovaginitis, there can be features like discharge from the coming out from the vagina and the vulva, pruritus, and sometimes foul odor can also be seen. Looking at the developmental changes and the role of estrogen in that, in neonates and infants, the hypothalamo-pituitary adrenal axis is active, and we see there's an elevated amount of androgens present there. So in this age group, if you see, ovarian cysts can be seen in them, labial adhesions can be seen, and also some congenital malformations can be seen in them. Coming to the pubertal phase, where the hypothalamo-pituitary adrenal axis is not active and there is deficiency of estrogen and the genital atrophy, this is the age group where vulvovaginitis is very, very common. Along with that, there can be some other skin disorders like lichen sclerosis, labial adhesions can also be seen. Once there is onset of puberty, we see that the hypothalamo-pituitary adrenal axis gets activated. Now, in this age group, the common disorders that we see are premature onset of puberty, that is precocious puberty. They can also present with vulvovaginitis, and pain can be one of the presenting symptoms in this age group. Coming to vaginal discharges per se in the pediatric population, vulvovaginitis alone constitutes to almost 62% of the pediatric gynae problems. Now, this is seen mostly in 1 to 10 years, and because the hair of the pubic region is not present and also the labial fats are not present, they are at a very, very high risk of developing them. And most of these infections are having non-specific causes. Some common bacteria that can be seen with the vaginal discharges include E. coli, enterococci, staphylococcus, and so on. The etiology, if when identified, can be also by specific organisms, which can either belong to a sexually transmitted etiology or a non-sexually transmitted etiology. Now, what is the normal vaginal flora made up of? We have mixed aerobes and anaerobes, the most common one being Staphylococcus epidermidis, diphthroids, lactobacillus, etc. The predominant bacteria that is found as an etiology for vulvovaginitis include Streptococcus pyogenes, Staphylococcus aureus, E. coli, and Streptococcus pneumonia. It is not only infection that causes vulvovaginitis, but also we see there can be chemicals and irritants which can lead to allergic vulvovaginitis. Now, the lower 1/3 of the vagina is very, very commonly seen in this chemical or irritant vulvovaginitis. The chemicals can be because of soaps, the bubble baths, the cosmetics, and also the sand and dirt that the child is exposed to. So whenever we have a case of vulvovaginitis, we should also rule out that there can be some underlying chemical causes which can be a cause of this. Coming to some dermatological conditions, lichen sclerosis is very commonly associated in this age group to produce vulvovaginitis and bleeding. So the lesions of lichen sclerosis are usually present as small pink and flat papules. Sometimes they coalesce together, they can become atrophic. And the epithelium is very thin and it is called as parchment-like epithelium. Now, the area involved in lichen sclerosis is the vulva and the perianal area. Now, sometimes even lichen sclerosis, there can be subepithelial hemorrhages. Now, this has to be ruled out from a very important cause, which is abuse and vulval trauma. Now, if lichen sclerosis is associated with a secondary bacterial infection, then again the clinical picture varies and the child is going to have more amount of discharge. Coming to some anatomical abnormalities. One common anatomical abnormality that has to be kept in mind is the presence of an ectopic ureter. Now, ectopic ureter is basically an anomalous opening of the ureter where it opens into the vagina or the perineum or sometimes even into the distal part of urethra. So the child is going to present with a continuous urinary leakage. And because of this, there can be the secondary infections which can either present as thick, white or purulent discharges, and there's going to be constant dampness that is present in the perineal region. So how are we going to diagnose this condition? An intravenous pyelogram is used for diagnosis, and also we need to rule out that the kidney on that particular site, whether it's functional or is there any other abnormality that is present in the renal system. The labia majora and the minora are the most common area of the vulva that are being affected. Sometimes we also see that the perianal region can be affected and the skin around the region can be reddened. Now, this patient can present with dried secretion and this secretion is called as smegma. Now, this smegma is a collection of all the desquamated cells and the urinary residues. The discharge is going to be either whitish or yellow-green color in most of the cases of vulvovaginitis. Now, causes of vaginitis when we take the prepubertal and in the pubertal age group, one important thing is presence of a foreign body. So, presence of a foreign body is again common in this age group, and chemicals, as we saw, chemical irritants can cause vulvovaginitis, and infections are the other causes of vulvovaginitis. Now, when we look into this diagnosis of vulvovaginitis, it is a very large spectrum. So, a careful history and an examination must be done to rule out sexual abuse and to come to the etiology of vulvovaginitis. Now, when a particular etiology has been found and a particular organism has been isolated, then appropriate antibiotics will be helpful for the child. However, if the vulvovaginitis is quite persistent, then the child requires a detailed evaluation and examination might not be very much possible in this age group, and hence examination under anesthesia is required. Now, examination of the child can be done in three different positions. One is supine with the legs drawn up, which is called as the frog position. Or the child can be placed in the mother's or the caregiver's lap for better evaluation. If the child is cooperative, we can also make the child to be on the gynecological chair in the lithotomy position or the knee elbow position. Some of this pediatric age group can also require an examination under anesthesia, especially when we have a deep lying foreign body which is very difficult to examine or to remove. Then under anesthesia, the child might require. Coming to the investigations that are commonly helpful in the diagnosis and management, taking a vaginal swab to look for the exact etiology can be useful. Microscopic investigation of the vaginal secretions to identify the organism. Vaginoscopy. A vaginoscopy is basically an approach which is most commonly associated with removal of foreign body. In a vaginoscopy, we introduce a scope into the vagina, which is usually a flexible scope. We look at the vaginal discharges and also we rule out any injuries in cases of trauma or sexual abuse, and also if there is any foreign body that is present, that can be removed with the vaginoscopy approach. Blood samples to rule out sexually transmitted diseases can be used, and an ultrasound of the abdomen, usually it's done with a filled bladder. This gives us a complete picture to understand about the uterus and the ovaries. Coming to the differential diagnosis that is present in cases of non-specific vulvovaginitis. Now, vulvovaginitis, because of specific pathogens like group A streptococcus, trichomonas, chlamydia, all of them like herpes and gonorrhea, they have a particular type of discharge. Say, for example, in trichomonas, we have a grayish kind of discharge. In genital herpes, we have the particular lesions of the herpes, which are multiple small pinpoint painful ulcers that is present. In case of gonorrhea, we have a purulent discharge that is seen. Coming to foreign bodies can either produce a putrid discharge, which is usually because of the secondary infection, or there can be a bloody discharge, which is present because of the trauma caused by the foreign body. And also the infection and inflammation, if present for a long time, can present as adhesions also. Coming to dermatosis again is usually diagnosed by the clinical examination. We can see various type of lesions like in lichen sclerosis and psoriasis. We have different appearance of all these lesions. Now, foreign body. The foreign body in the vagina is a very common thing in the pediatric age group, and hence this has to be always ruled out when the child is having purulent discharges or the child is having persistent vaginal discharge despite the use of antibiotics, despite ruling out other causes and also maintaining a good perineal hygiene. The mother or the caregiver can give us a history that the child has the habit of putting in small objects into the vagina. However, in most of the cases, we see that this history might not be very appropriate too. So whenever to rule out a foreign body, one important thing is to do a careful vaginal examination. It can be done under anesthesia if the child is not cooperative, or a vaginoscopic approach can be used to identify and remove this foreign body. Coming to labial adhesions, a labial adhesion is a condition in which there is fusion of the labia minora. This fusion of the labia can either be a partial fusion, a complete fusion, or a subtotal fusion. Now, this adhesion between the labia is usually very thin and it can present with a translucent membrane that usually closes the vulva. Now, this can be seen in this age group because of the physiological condition of hypoestrogenism, or it can be because of poor hygiene and chronic long-standing infections and inflammations. Use of chemical substances, especially wet wipes, can also increase the chances of labial adhesions. Labial adhesions is very commonly seen between the ages of 13 to 23. Not to forget that this age group, the use of diapers, diaper creams and rashes can make the child more prone to develop labial adhesions and infections and vulvovaginitis. Looking at some scenarios which we can expect pertaining to vulvovaginitis. Now, vulvovaginitis, though, is very common in the pediatric age group, the majority of the population presenting with vulvovaginitis belong to the reproductive age group. Now, we have a scenario given here. We have a 15-year-old girl who is presenting with vulval pruritus and burning. She reports dyspareunia and copious foul-smelling greenish vaginal discharge. On examination, there is erythema as well as petechiae that is seen in the upper part of vagina and cervix. What can be the most likely diagnosis? Now, understanding that different organisms have different kind of presentation, let us look into the scenario. We have a 15-year-old girl. Her discharge is foul smelling and greenish in color. She's reporting of dyspareunia. That means she's sexually active, and not to forget the STDs too here. And a typical examination, when she's got erythema and petechial spots, which is also called as strawberry cervix or strawberry vagina, and the organism associated here is going to be Trichomonas vaginalis. Usually chlamydia, most of the times it is asymptomatic, and they can have a history of infertility when presenting in the age group of more than 25 years. And chlamydia is seen when women or a girl is having multiple sexual partners. Gonorrhea again is a sexually transmitted disease, and here the child or the women can present with copious discharge, and for gonorrhea we need to understand that antibiotics need to be used appropriately. Coming to syphilis, now syphilis, depending on the stage of syphilis, the presentation can vary, right from primary, secondary, tertiary to the more complicated one like neurosyphilis. Trichomonas vaginalis, as we just saw, it is going to be a greenish vaginal discharge, foul smelling, intense pleuritis, and strawberry vagina and cervix can be seen. And for Trichomonas vaginalis, not to forget that this is a flagellated organism, and sometimes you can have an image-based question with the flagellated organism present there. In candidiasis, it is a fungal infection caused by Candida albicans, and the typical discharge is going to be a curdy discharge, and that's going to be intense pruritus. Now, knowing the organisms is very, very important. Some tricky points to remember here. We know the normal vaginal flora is usually a mixed one. It has both aerobes and anaerobes as a normal flora. And the most common organisms we see here include Staphylococcus epidermidis, diphtheroids, lactobacillus, and anaerobic bacteria like bacteroids. Candida, it is a fungi, and mostly it is associated with diaper dermatitis. So if Candida has been given as one of the organisms, we have to understand that it is not a normal flora that is present there, because we see that she has got sepsis. Looking at the presentation, we have two important things. One is the use of tampons, and second one is the presence of sepsis. So if we have a tampon user and we have sepsis, what are we going to think about? With the organism that is listed here, it can be linked either to Staphylococcus aureus or it can be linked to Streptococcus. Now, Staphylococcus and Streptococcus, one important thing is we have to see the subgroup of organism that is being mentioned there, because we know epidermidis is a normal flora of the vagina. Coming to Streptococcus, group B Streptococcus is the one that is associated with early onset of neonatal sepsis, and hence the woman who is going to require screening and taken a swab from the rectum, from the perineal region and the lower part of vagina to understand whether she is a carrier of group B Streptococcus. Now, group A Streptococcus is the organism, it's a very notorious organism, and this is going to lead the woman into toxic shock syndrome. So, just because it is mentioned as Streptococcus, do not go with the flow, as the subtype of Streptococcus that is mentioned here is group B Streptococcus. So, tampon usage with pyrexia, that is sepsis, we need to think of the organism Staphylococcus aureus. Going into the last scenario, here we have a 30-year-old woman who uses copper intrauterine device for contraception, and she is being treated for pelvic inflammatory disease, but she is not responding to antibiotics in spite of changing her regimen. Smear is showing that there is some organism, but because she was asymptomatic and she did not require any treatment. So, a copper intrauterine device, when she is being treated for pelvic inflammatory disease, we need to look at what is the organism that is being reported in the smears. Okay, if there is going to be presence of sexually transmitted diseases or severe PID, that warrants her to have an antibiotic regimen to cover for the organism. However, if there is going to be presence of actinomycosis, then we need to remember that that is not the cause of PID, and the copper intrauterine device, when a woman is using that, actinomycosis can be seen, and sometimes instead of the organism there can be just presence of sulfur granules. So actinomycosis presence not always requires removal of copper intrauterine devices. So that's one important thing that you have to keep in mind. So these are the answers here. Now, This video is basically to help you prepare better for the examination. Stay tuned, look into our YouTube channels to understand that the exam has various modules and how to prepare and approach to each of these modules. Thank you.